Hello, my name is Rikoma Domash. I am a member. Hello, my name is Rikoma Domash. I am a member of the Developmental Behavioral Mental Health SIG at the National Association of Pediatric Nurse Practitioners. I am here today to talk to you about the mental health care needs of children and youth with special health care needs. I am a developmental pediatric nurse. I'm board certified in pediatric nursing and psychiatric mental health nursing. I am also a student pediatric nurse practitioner at University of South Alabama, and I'm excited to be here with you. I'm here today with Jennifer Keller. She is a pediatric nurse practitioner and a psychiatric mental health specialist at the Children's Hospital of Philadelphia. And we are excited to present to you today with our shared expertise. I was hoping that all of you could share with us who is here and where you're from, as well as what brings you to this presentation today. The U.S. Department of Health and Social Services considers children who have or are at increased risk of chronic physical, developmental, behavioral, or emotional conditions, and also requiring health and related services of a type or an amount beyond that required by children in the general population to be children and youth with special health care needs. Many children in this country fall into this category. The CDC reports that 1 out of 5 children in the United States fall into the category of children and youth with special health care needs. The National Survey of Children's Health estimates that 19%, or 14 million, out of children under 18 years of age in this country, 25% of homes, and an increased rate of those who are experiencing poverty and public insurance are experiencing this situation. As we all know, the COVID-19 pandemic has also brought about a pandemic of mental health in children and youth. We have seen an increase in children with mental health needs, as well as children who are having difficulty accessing these needs. It becomes important for us to explore this topic. I wanted to let you know that Jennifer Keller is in the comments section and waiting for your comments. She will also be providing more resources as you ask for them. So let's say you have a child with a special health care need, or you are taking care of someone with a special health care need. What puts them at increased risk of mental health needs? So, as we discussed earlier, some children meet the criteria for special health care needs based on their mental health needs. So either developmental, behavioral, or emotional concerns. Because of that, they obviously have more needs related to mental health. With the decreased staffing that we've seen since the incidence of the pandemic and the changes in how services are administered and rendered, we've seen children fall through the cracks. One of the things that we've seen has been children who were supposed to be receiving therapy services in person had to pivot to virtual services, which may or may not have worked for the type of care the child needed. And then the other thing we saw was children who were receiving their services in school may have lost those services when schools pivoted to distance learning. What else are we seeing? We've seen children lose their medical insurance, or their families lose a job, which might have led to them needing to switch providers related to their insurance. This is a very, very big challenging situation, as many mental health providers do not participate in all insurances. A lot of insurances also seem to have what's called a ghost list of providers, where not all providers have access. Not all providers on the list are currently still paneled or have availability for patients. What about other categories of special health care needs? So let's take a child, an 8-year-old boy with asthma. So the 8-year-old child with asthma, he was in school, he was receiving a lot of help from his school nurse potentially, or the school was providing him with structured activities that allowed him to participate in sports in a safe way because there was staff at standby for if he needed assistance. Well, distance learning, change in how often he saw his pulmonologist or even his pediatrician might have changed how his asthma is managed. And now in the long term, has that impacted how he is able to interact with his friends, activities he's able to do, what's safe, what's not safe, or maybe simply he is a little more concerned about social activities. This puts him at a higher risk of depression, anxiety, or even just social isolation. Now, how is this child going to be identified as higher risk of mental health care needs if he's not accessing those services? We don't typically consider a child who has asthma to be at high risk of mental health needs. This is something that is so important for all of our providers and families to be aware of, that even when we don't think of it, it's important to be aware of the needs of the children. Okay, so you have concerns about your child. Maybe you have some developmental concerns. Maybe you have some concerns about how their mental health needs might be impacted by their medical needs. Well, what's next? What are we going to do? I just mentioned that it's really hard to get into a provider. Anybody? Well, the first step can be to reach out to the people who are already involved in this child's life. For children of school age, reaching out to the school can be a first step. Sometimes schools have access to guidance counselors, short counseling, social skills groups, or other providers. That can be a first step. The child may also need behavioral management or changes to their academic program via a Section 504 plan, which might allow for some accommodations in a less formal way, or an IEP, which is an individualized education plan, which does require a more in-depth evaluation. Okay, so that's school. Now we have the child's pediatrician or pediatric provider. In general, pediatric providers tend to be very well versed in the mental health care needs of their children. So if you have concerns about your child, start off with the pediatrician or pediatric provider. Start off with calling and say, hey, I'm concerned. My child's been less social than lately. Or I'm concerned that my child's not talking as much. What do you think I should do? The pediatric provider is able to screen for mental health emergencies, get help with accessing other services, or may even be able to provide services in the interim while waiting to access specialist care. For children who are equipment dependent, technology dependent, or get services in the home for their medical care, the home care provider might be a great resource as well. Okay, So we have the school and we have the pediatric and other healthcare providers. What's something we missed? Parents can talk to their child. It is very important that parents get comfortable talking to their children about how they're feeling and how their safety might be impacted by their feeling. The research shows that we never increase the risk of suicide or non-suicidal self-harm by asking a child if they're feeling suicidal. The simple statement by a parent or a provider of, hey, I noticed you're not feeling so well. You don't look so good. Are you feeling really sad? Are you feeling hurt, lonely, anxious? Are you feeling like you might need to hurt yourself? Are you feeling like you'd be better off not around? Are you feeling like you want to kill yourself? Those are really important questions to ask. Children are very honest often, and they often don't know how to bring the topic up. So let's be able to ask those questions so that we can prevent a tragedy. Now let's talk about some other needs that we might have. So you have a child who maybe has a developmental delay. Maybe they're really young, maybe an 18-month-old that you've noticed they're not really talking as much as other children their age. They're not really playing with me. They don't seem to be interacting. Well, here again, we're going to talk about the main places you can go. Let's talk to our pediatric provider. The pediatric provider might be doing some screenings, very structured screenings at appointments. But even if they don't recognize a specific need at those appointments, you can always reach out and say, I'm not sure my child is meeting their developmental milestones, and I'm not sure that I'm able to provide enough resources. Every state has an early intervention program. Every state's early intervention program is structured slightly differently. It's really important that you speak to your local providers to find out what steps you might need to take in order to get your child set up with early intervention. For the most part, there are statewide registration programs. So a phone number to call or a website to go on to access an early intervention evaluation. Every parent is eligible for an evaluation for their child. If you have concerns, you reach out to your state's early intervention organization. They can do an evaluation and also provide services depending on your child's needs. It's very important to remember that the services they provide are typically developmental. They're not typically diagnostic, which means that if your child needs to move forward with further evaluations, you may then need to get a step forward to get a developmental pediatric evaluation or a neurologic evaluation. But that is the first step to getting the care you need. Sometimes parents are concerned that their child has maybe on the autistic spectrum. For these children, again, starting off with the pediatrician and then potentially going forward with other evaluations to get the care that your child needs. Remember, though, that the earlier you start with other services, like if your child requires speech therapy or other therapies, those therapies will help whether or not you have a diagnosis to explain the behavior of your child. And therefore, it's really important, even while you're waiting, and especially while you're waiting to access specific diagnoses, to get as many services as you can. The early intervention program may also be a great way to segue into services in school, in preschool, and moving forward. Finally, I want to be very clear. As a parent, your mental health is so important. As a parent, it's important to reach out. So if you're struggling, whether related to your own needs or to the needs that your child is having, reach out to your providers, talk to the pediatric provider, talk to other providers involved in your child's care to make sure you're accessing the services you need. I wanted to open up the floor to any questions. I'm going to look over into the chats. If you have questions, we can help you potentially with them. I see that Jen has answered regarding having conversations about difficult conversations with families. And she made some really good points that I want everyone to look at. That children with special needs and special healthcare needs may demonstrate their pain or discomfort through behavior. So, being aware that the behavior your child is demonstrating is telling you something. Behavior is communication. So, if your child is trying to tell you something through behavior, let's try to find out how. Can we see if they're in pain? Depending on their health needs, maybe they need some better management of their symptoms, and not discounting those needs. Any other questions? I know that a lot of people have in the past asked about the long waits for mental health providers. So, in addition to obviously reaching out to your insurance to find what services are available, most states have something called a mobile response. It might be called different things in some locations. And usually this is a phone number or a website that a family can call when their child is in crisis. And in crisis doesn't have to mean that they're hurting themselves. It's when the child needs help and you're not sure what else to do, and you have concerns about what might be the long-term impact. So a child who is hurting themselves, hitting their head, things like that, or just having a really hard time with control. Usually you can have the services come out to the home and do an evaluation, and also access some services through them. The other thing I wanted to point out is sometimes parents of children with special healthcare needs wonder how they can advocate for their children's needs in school. So the SPAN, which is a parent advocacy network, has a lot of resources on making sure that your child is being given access to all the services that they may need. And they do a lot of advocacy through the school systems. And then some of it might be getting creative. Sometimes, can your child participate in a virtual therapy session? Can your child participate in a group, which might be a little easier to get into than an individual session? Can your pediatrician co-treat with a specialist who might be harder to get into? And those might be some great resources. So I see Stacy asked another question for Jennifer. And I think that Jennifer is trying to put together some resources for you, Stacy. That's what it looks like. Jennifer, was there anything else that you wanted me to touch on? Okay. It looks like the chat box is kind of quiet. Is there any Um, I know that I have the participants. We have a student from Emory who's going to be a wonderful PNP, and I'm so happy that you are. I'm sorry, not a student. I have Stacy here who is going to be doing a seminar with the Emory PNP students. Thank you so much, Stacy, for advocating for the needs of our children. And thank you, Rhonda, for joining us. Um, if there are no further questions or topics that we wanted to address, I can keep this open for a little longer. But otherwise, we can go ahead. Let me see. Okay. One of the things that is important to remember based on that is, based on all the information, is that the climate surrounding insurance and some of the mental health needs or some of the other difficult challenges that our families are facing, like related to social determinants of health, such as housing and food insecurity, really can be a very difficult topic and can really contribute to increasing mental health needs. And so when we do our social determinants of health screening, or we talk about these things with our provider, with our families, the reason why we're asking is not to get into people's business. The reason why we're asking is because we want to make sure that we understand the things that might be putting their child at risk, and how we can address them. And the single most important thing that families can do is to advocate for their child. And so remember that you're your child's specialist. You are the one who's with your child. So if you are talking to providers and you feel like you're being discounted, you advocate for your child. You are definitely your child's best specialist. And I want to commend the amazing, tremendous, difficult work that you're doing to provide for your child's security, and allowing them to overcome the difficult experiences they're having. Thank you, everyone, so much for joining us today. We will continue this conversation, hopefully. Thank you to the National Association of Pediatric Nurse Practitioners for hosting this. Thank you, Jennifer, for helping us with some resources. And thank you for all of our listeners. Have a great day. Okay, it looks like things are quieting down.